And as you heard from Carolyn's report, Valenzuela City is one of the cities that has implemented expanded testing. And we now speak to City Mayor Rex Gatchalian. Good morning, Mayor. Thank you for taking our call.
Ria, good morning, and good morning to all your televiewers. Thank you for having me.
Mayor, as of now, how many suspected COVID-19 patients have you tested?
We're already halfway through our list of PUMs and PUIs, what they used to call PUIs. In total, those two would be around 550. And right now, we're already halfway through. So we're a little bit over 300. And then by this weekend, we would probably be done with all 500. So 550. So we would have hurdled all PUMs, the former PUMs, and then what they used to call PUIs, whether suspect or probable. And then we're going to move on to all frontline workers, and then we're going to move on to coming home OFWs.
All right. Carolyn Bonquin, in her report moments ago, said that you're planning to test about 25 people a day. Have you reached that target, and do you plan on increasing that?
We have. Let me just qualify it. Our memorandum of agreement with the medical city, which was one of the first ones now between a public sector entity like Valenzuela City and a private sector, so it's a PPP, says that every day Valenzuela actually bought 1,000 kits a week. Now, the medical city will do the processing for us, and they can do an average of minimum of 25, but they can rev it up to 40 in a day, with a turnaround time of 2 days. Now, that means if it's just 25 a day, if they stick to the minimum, we would be done by 20 days' time. But given that they're moving faster, meaning they're giving us more capacity, so they're already revving it up, we should be finished by this weekend. Ria, I just want to point out at 10 a.m. this morning also, I think one of your reporters will be covering it. We will be signing with another FDA-approved laboratory that's based in Metro Manila. They just got their accreditation for stage 5 recently. And then what they promised us, the MOA will contain 90 processing kits in a day. So that's together with the TMC, that's 115 kits processed in a day. So we will be really done with all our PUIs, PUMs by this weekend.
All right. So what will this new partnership bring to your city, Mayor? It's just further testing. Is that right?
Yeah, basically it's the same agreement with the medical city. I just don't want to name the entity yet because I haven't really signed the MOA yet. I'm signing it at 10 a.m. this morning. So if the medical city is giving us capacity for processing 25 of our test kits all the way to 40 in a day, this partner will peg it at 90 for the next 2 weeks and then bring it down gradually to 25 to 50. So meaning in the next couple of days, we will have 115 test kits processed per day. And as I mentioned, we only have 550 PUIs or PUMs, PUIs and PUMs. So by Saturday, we will have zero backlog already. Meaning the next week, we will start entertaining all frontliners for our public hospitals, then all frontliners for our private hospitals, and then all policemen, other frontliners who are in the peace and order side. And we will also be entertaining new calls, meaning Venezuelanos who will be calling with new cases, potential new cases.
Mayor, what happens when one of your constituents tests positive for coronavirus? What is the process for them once they've gotten that result?
That's a very good question. Actually, right now, the process is whenever somebody tests positive, we put the entire house in lockdown. Or whenever somebody is in close contact with somebody who is positive, that used to be called a high-risk PUI. Now it's called probable. The entire household is put under lockdown, meaning we barricade the house, we put health workers in front together with policemen, making sure that they follow the quarantine procedures. Now, with this new testing, what we can do is further streamline the number of households we will put in lockdown, because the more people that we suspect as being positive means more households we're putting in lockdown, means more resources exhausted for this lockdown effort. So what we're going to do now is isolate only those that are positive, making sure that their houses are in lockdown, or we can move some of them to our central isolation unit, which we have featured a week ago. Our 70-bed isolation unit, we have two of them. So we will operate one and put those that test positive in one of them. Now, the other people who will test positive with symptoms, of course, we'll bring to healthcare facilities so that they get the necessary medical intervention. So the beauty of this is, rather than just isolating people by mere suspect, we're actually going to test everybody, pin down who will be positive, isolate that person or quarantine that person, or give them the necessary medical intervention.
Okay. Another issue, Mayor, of course, is assistance given to families that need it the most. How is the distribution in your area?
Can I step a little bit backwards before we talk about the SAC or the SAC? The city is already embarking on its second wave of food vouchers. That's what you can see in the picture. Initially, when the lockdown happened, we distributed 112,000 food vouchers, 112,000. That targeted near poor families, poorest of the poor families. But now we decided to expand it. We're now up to 215,000. This will cover even our middle class or working class families so that we can make sure that before, if they weren't hurting, now they're hurting, they get food assistance from the city. We should be done distributing all these food vouchers by Friday or Saturday this week, latest probably Sunday, and they start redeeming it Monday. That will take another 7 days to redeem. Now, on top of that, we are simultaneously distributing the SAC forms. We were given 82,000 forms. Of course, it's not enough, but we'll start distributing it. And then the balance, we will appeal with DSWD, hoping that they grant us additional forms in the process.
Okay. Thank you for your time this morning, Valenzuela City Mayor Rex Gatchalian. We do appreciate your time.
Thank you, Ria, and thank you